Hello, everybody, and welcome to Dining for Women's Google Hangout for the month of March. I am Veena Khanke, the Program Director at Dining for Women, and today I have two guests with me. First, I have Catherine Hefner, who is the Web Content Manager for Dining for Women. Hello, Catherine, how are you?
Okay.
I also have with me Debbie Young, who is the Executive Director for America's Association for the Care of Children, and she joins us from Boulder, Colorado. Hi, Debbie.
Hi, everyone. Thank you.
AACC was established in the year 2007, but the group has been working with the community since about 1997. They have been focusing on the lives of young children and their families. So, Debbie, would you like to share the details of the program with us?
I'd love to. Thank you. So, as you said, we started our program in 1997. However, I started work in 1984 in Jalapa, Nicaragua. I was 6 months pregnant and had a 3-year-old child. And what I learned from working with the primary caregivers, mostly women in that area, is how to best serve their needs. And we've come up, AC has come up with, in sharing with the women, a model that can really attend to sustainable change in the quality of lives of young children and their families. And so that model is called CPET, and CPET stands for Community, Education, Participation, Empowerment, and Transformation. The first piece about that, community, is really about building relationships. Relationships are the foundation of learning, of caring, and really of sustainable change. The place we work in is in Jalapa, Nicaragua, which is located just at this tip on the border of Honduras. Down in south is where the capital city is. So even when resources and funds flow into the country, rarely do they make it up into this rural area. It's very isolated, the area, from the rest of the country. There is tourism that we've heard about in Nicaragua. However, that's south of the capital city towards Costa Rica, not north towards Honduras. And there's some photos of the women. And how we started is many of the women, we have a program where we distribute vitamins to some of the communities. And the women asked us if we could bring more information. During the distribution of vitamins, we give about a 30-minute workshop or charla, and we promote exercise and nutrition and other preventative health pieces such as potable water. Our whole program, AC, really provides those serving below the poverty line with preventative health care, education, potable how to use and make potable water for their families, since it reduces so much of the health challenges they suffer from, nutrition, and providing ways to have food security. So the reason why we work in northern Nicaragua, again, it's very isolated. 50% of the residents are illiterate compared to 20% of other Nicaraguan areas. 90% using public services are underserved, have very limited access. Most people can't even afford the transportation that it would cost to go from their home to the municipality of Jalapa. These are the villages that we work in. So part of what we really want to do, as I mentioned before, is to build those trusting relationships. And how we do that is we go to people's homes and we share information that really is important specifically for that person and their challenges. This program is training 10 promoters or 10 women to do those home visits and community workshops. Once they've done the home visits, they find shared commonalities between the neighbors in that community. Bringing them together in a community workshop really helps the accountability and the resource availability as they become resources for each other as they move through their challenges. We're focusing on prenatal, labor delivery, infants, and early childhood up to 18 months because, as we know, that first start of life really impacts the rest of the quality of our lives. So we are hoping that these 10 promoters will access or at least attend to a minimum of 830 pregnant women during the 2 years. We'll be working in 2 communities, one Linda Vista, which has not received outside help from anybody in the 30 years that I have been working there. They're very isolated. It takes about an hour to drive to the village and then another 20 minutes to walk up to the village. So that's one reason why we chose that community, is because they've not received help and assistance prior. Another community, Escambray, that we'll be working is also up in the mountains, but only about 40 minutes from Jalapa. The reason why we've chosen them, and this is the community of Escambray that you see there, is because the women have asked us to come and provide the services to them. So we have been invited there. And the last place that we will be attending to is the Casa Materna. Casa Materna is a place where the women, when they're reaching the end of their pregnancy, because they're so isolated in the mountains, they come and stay anywhere from 2 weeks to 3 months at the Casa Materna. If there's problems with their pregnancies, they tend to stay longer there. And it's close to the hospital so that they'll be able to reach the hospital when they deliver. We work very closely with Casa Materna. Here's a picture of the nurse during our vitamin distribution. The nurses will also be attending the trainings, but not to become a promoter, but to really be able to support the promoters in their work and to continue to develop the relationship with the Ministry of Health. And the reason why we really want to do this is so that we can help give these children the best possible life and future available. And thank you for your interest and support in our project.
Thank you so much, Debbie, for that wonderful presentation. We can see how AACC is working so hard to reach these very isolated communities of mothers and babies. So can you expand a little bit on how exactly you will be recruiting these 10 promoters, and also how you would reach out and recruit the pregnant mothers?
Great. So out of a pool of 60 to 80 people, which have been collected in the rural areas around the municipality of Jalapa as well as within Jalapa, they will attend an orientation, and we will choose 10 of those 60 to 80 applicants. How we have chosen the mothers, again, is that very rural area that has never received any services. They have a very high incidence of teen pregnancy. And so it's an area of focus that not only is AC trying to attend to, but the government, local government, is trying to attend to as well. And then Escambray, because we're invited, they have approximately 40 to 50 women who are pregnant every year. And so they are really hoping to reinforce the knowledge and the skills that the local women have, not only for their community, but they have several mountain communities around them that they're hoping that this knowledge will spread to.
Okay. Well, you've described the isolation of the communities. So how exactly would you kind of assist in this kind of collaboration between the promoter and the mothers? Will the mothers be available always to show up to some of the workshops? How would it work?
So this is the most fun part of the whole program. So the promoters, during the trainings, we have class time in the morning and field work in the afternoon. And what we develop is our skills, again, to build relationship and how to share knowledge so that the people who receive it start to absorb it and it becomes theirs. And we do this through the home visit. We go to the homes, and we always go in pairs, and we take about an hour. And if the mom, say, is husking corn, we just sit with her and we husk corn with her. If she's washing dishes, we'll go out to wherever the area she's washing dishes, and we'll help. And we have these conversations, and we find out about who she is, what her dreams and aspirations are, what her challenges are, and how best we can help her find ways to meet those challenges. And that's how we build relationships. We really get to know each other. Once we find out the individual needs and concerns, that's when we bring the women together so that they can start using each other as a resource. They've already built the relationship with the promoter, so they're really bought in and want to attend the workshops. And the workshops are really fun. They're just not about sharing information. They're really about how to regulate your nervous system. So we practice ways of breathing. And it's really about having fun with each other as well. and the joys of being a mother, and the joys, even if we are poor, and all these challenges, that we can really capitalize on the joy that we have available to us.
So Debbie, since this is such an intensive program and you are capturing these mothers during their pregnancy, tell us more about the future of the program. Do you follow the mothers well after they've had their babies? How long do you follow them? And at some point, the Dining for Women funding would be over. So what happens then?
So we do follow. The very first phase is we attend to approximately 35 moms in that first 3 months. They will be attended to all the way to the end of the program. So that first 18 months of the child's lives. Many of those community workshops actually turn into play groups. So a lot of these moms hadn't really had a lot of time to play when they were younger. So they get to learn how to play and do their chores and play with the children at the same time. And we practice that because it's unfamiliar. And so we do follow them through the 18 months. The women that won't be followed through the Dining for Women funding for the 18 months is the women who come on board and are pregnant at the end. However, what our plan is to show the outcomes to Ministry of Health, Ministry of Family, which is the social services, Casa Materna, and the Mayor's Office, the impact and the cost analysis of the program, hoping that they will see that by paying the promoters, they reduce the costs in the hospital and clinics, and they'll continue the program.
Okay. So is it your hope then that you will have a long-term partnership with the Ministry of Health, that you will always work in tandem with them and kind of help these rural communities and possibly move on to others?
Absolutely. And it's really key to work with the Ministry of Health because that's the sustainability. You know, we will leave at some point. We are not residents of the community. They are. So really working closely really builds that relationship, which creates the sustainability of the program.
Okay. Well, Debbie, it has been a pleasure talking with you. And as you know, our Dining for Women family love mothers and babies. So we wish you all the very best in the success of your program. And we look forward to hearing from you about the success of the program. So thank you so much.
Thank you for your support and all what you do.
Thank you.